we're going to perform a cardiovascular assessment. Good morning, I'm Christine, your sleep nurse for today. Could you please verify your complete name and your birth date?
Our Tony Tulod, August 14.
Okay, thank you. How would you like to be called first?
Tony.
Okay, Tony. Thank you, Mr. Tony. That was just to ensure that I'm speaking with the right patient. So today, Mr. Tony will be conducting an assessment on your heart area. This is to check for any abnormalities, and all significant findings will be cascaded to your doctors for the next treatment plan. So, do you have any questions, sir, before we begin? Okay, thank you. Alright, Mr. Tony, I might ask you to undress for me and change to a hospital gown for an easy assessment later on. So, do you need anything help in changing? Alright, once you're done, please take a seat on the examination table. Before we proceed, we must perform hand hygiene first to prevent the spread of any microorganisms, and we need to stand at the right side of the patient with the patient in a supine position and the head is elevated 30 to 45 degree angle. Now I'm going to assess the heart and precaution of the patient, which is the region on the chest wall that overlays the heart area. The first thing that we need to do is the inspection. We're going to inspect the precaution for any cardiac surgery related scars, and note that any chest shape deformity and unusual pulsation. So for the findings, there are no cardiac surgery related scars, and I haven't noted any chest shape deformity and unusual pulsation. Next is palpation. I'm going to palpate the right and left carotid artery one at a time. Always remember that do not palpate the left and right carotid artery at the same time, because this can compromise blood flow superior to the location we're palpating. Next, I'm going to place my index and middle finger near the upper neck between the sternomastoid and the trachea. Next, I'm going to gently tap the head of the patient to relax the sternomastoid muscle. I'm going to palpate your carotid artery. So, could you please tap your head like that? I'm going to palpate first the right carotid artery. So for the findings, the carotid pulsations are symmetrical. Next is the jugular vein distension. To ask the patient to turn to their left side so that we can assess the right side. Then I'm going to locate the sternomastoid muscle to where the external jugular vessel rests. And I'm going to take note that the jugular vein is bulging or large. Then I'm going to observe the pulsation. So, Mr. Tony, could you please turn to your left? So, for the findings, the jugular vein is slightly noticeable but not bulging. The central venous pressure reflects the blood pressure in the right atrium or the superior vena cava. First is I'm going to identify the jugular venous pressure at the highest point of pulsation. Then I'm going to extend the card or ruler horizontally from the highest pulsation point, cross with ruler placed in the sternal angle or the angle of Lewis. Then I'm going to add a 5 cm to get to the center of the atrium. findings, the central venous pressure is 8 cVp, which is within the normal range. Next is the aortic and pulmonic area. So it is where the base of the heart is located. The aortic area is located on the second intercostal space at the right sternal border, and the pulmonic area is located at the second intercostal space left sternal border. So to do this, we're going to use the palmar side of our fingers, which is the index, the middle, the ring finger, and the pinky, and gently palpate the aortic and pulmonic area, and always take note for any signs of pulsation. So, Mr. Tony, I'm going to check your pulmonic and aortic area. That is good of you. Okay, so I'm going to expose your chest. So for the findings, there are no signs of any palpable vibration or thrills. Next is I'm going to palpate the Erb's point of the patient, which is located at the third intercostal space, left sternal border. So, Mr. Tony, I'm going to palpate the Erb's point. I'm going to expose the area. So for the findings, there are no palpable vibrations or thrill. Next is I'm going to palpate the tricuspid area, which is located in the fifth intercostal space, lower left sternal border. So Mr. Tony, I'm going to palpate the tricuspid point. I'm going to expose the area. So for the findings, there are no palpable vibration or thrills. Going to assess the mitral and apical pulse, which is located in the fifth intercostal space, left mid-clavicular line, and I'm going to locate and palpate the apex beat. Then I'm going to localize the apical impulse by using one finger pad, and I'm going to ask the client to exhale and then hold it in to locate the pulsation. And lastly, I'm going to ask the patient to roll midway to the left. Sir Tony, I'm going to assess your mitral or apical pulse. So I'm going to expose the area. And I want you to take a deep breath for me and hold it in. Okay, 2, 3. Can you please go to your side and your left side out? Take a deep breath. So for the findings, there are no palpable vibration or thrills, and the beats is 73 beats per minute, which is within the normal range. Next, I'm going to auscultate the four anatomic sites: the aortic, the pulmonic, the Erb's point, and the tricuspid. So to do this, I'm going to concentrate on one particular sound at a time in each area. So first, the heart sound, followed by the systole, then the second sound, which is the diastole, and I'm going to use both diaphragm and the bell of the stethoscope. I'm going to expose the area to use the diaphragm. of the stethoscope. So for the findings, S1 is heard at all sides and louder at the apical area. S2 is heard at all sides and louder at the base of the heart. And there is no presence of sharp sounding ejection clicks. After assessing the patient to change clothes, I'm going to perform hand hygiene. So Mr. Tony, since I already gathered all the information that needed, rest assured that all these results will be kept confidential and will be cascaded to your doctor for the next treatment plan. So, thank you, Mr. Tony.